Hello and welcome to the Friendly Pharmacy 5, Pregnancy and Breastfeeding during COVID-19. My name is Lindsay Dixon. I'm from Victoria, BC, Canada. I'm a pharmacist with over 10 years experience. All the information here is based on available evidence as to the date of posting, and this information does not substitute the need for consultation with your physician and/or local pharmacist. Okay, so today we'll talk about immune system function during pregnancy, COVID-19 in pregnancy, what we know today, some guidance around your medical appointments. We'll talk about breastfeeding and precautions for healthy community living during pregnancy. So immunity during pregnancy. We know that during pregnancy, your immunity is in constant flux or modulated. So there are times when your immunity is somewhat suppressed and you could be more prone to infection. This could be partly due to progesterone, which is higher during pregnancy. And also during those early weeks of pregnancy, some women do struggle with a fair amount of nausea and fatigue. This could lead to reduced nutrition and could leave your immune system more susceptible to infection. So COVID-19 in pregnancy. So in general, women who are pregnant are at an increased risk of complications from respiratory infections. This is before COVID-19, okay? So now that we are in the pandemic, we don't have any evidence today that pregnancy puts you at a higher risk, in particular for COVID-19. However, the evidence we have is very limited and there is very little data. The symptoms of COVID-19 in pregnant women have been very similar to people who are not pregnant, fever being the most common symptom in people who are hospitalized. So please be cautious. There's very little data available, and I think you should consider yourself high risk until we know otherwise. So if I have COVID-19, will my baby get it too? So right now, there is no clear evidence that this is possible. So there have been cases of COVID-19 in pregnancy, and these have not shown direct links of maternal fetal transmission. So that's good. However, like I said, the studies are very limited and we need more data and we need more time before we can come to this conclusion. Medical appointments. So during the pandemic, it is important that you see a physician. However, you may have a reduced frequency of medical appointments. So if you've been pregnant before, you may notice that maybe you're seeing your physician more online, you're not going to the clinic quite as often, and that's just to help protect the people who are high risk and who do have to go in, and it's also to help protect you. So you can be assured that your doctor is going to do the very best for you. You're going to get great care during this pandemic, but you might have a reduced frequency of appointments if you are low risk. Breastfeeding if I have COVID-19. So if you are diagnosed with COVID-19, you should definitely continue to breastfeed. So good hand washing and good hygiene is essential. And at this time, if you have COVID-19, it is recommended that you have a mask. And I would say that if you are pregnant right now, it might be a good idea to get your hands on a handmade mask, even if you're going to have your baby in the fall, because there is the chance of us having a second wave of this in the fall, and it might be something that you want to have on hand. If you are diagnosed, we do not recommend that you separate yourself from your infant. We know that breast milk is protective. It helps to protect the baby and helps to strengthen the baby's immune system in fighting off infection. So breastfeeding could be very helpful during this time. Breast pumps. Now it's more important than ever that you clean your breast pump. So proper hand hygiene before each use, of course, is essential, but regular cleaning after every single use is very important. Wipe down all the parts that come in contact with breast milk with dishwashing soap and follow all the recommended cleaning from manufacturers. Having a healthy pregnancy during a pandemic. Proper hand hygiene and don't touch your face when out. You already know this. I do think that you should consider a mask when you're out in a higher density population. So if you live in a busier city or if you're going out to a grocery store, I do think that this is something that you should definitely consider. Proper nutrition is essential for a strong immune system, so a diet rich in colorful whole foods and low in sugar whenever possible. Sleep, a consistent bedtime, and if you can eliminate screens 2 hours before bed, that's going to give you a better quality of sleep. Self-care, so exercise, music, prayer, meditation, deep breathing. If you can do even one of these every couple of days, this is going to help your mental health and your physical health, and that is going to help you to have a strong immune system. Continue with your prenatal vitamin and all your prenatal visits. Here's some resources for you, and as always, your local pharmacist is always there for you as well. Thank you very much. That's where to contact me. I'm on Facebook at Friendly Pharmacy 5 and YouTube at Friendly Pharmacy 5. Remember to stay home, save lives, and plank the curve.